अस्सलाम वालेकुम डियर स्टूडेंट्स। उम्मीद है आप सब खैरियत से होंगे। इस लेक्चर में हम बायोमैकेनिक्स ऑफ द स्पाइन कंटिन्यू रखेंगे और हम थोरेसिक स्पाइन की बायोमैकेनिक्स ब्रीफली डिस्कस करेंगे। एज हमने स्टार्ट में बताया था कि हम बायोमैकेनिक्स ऑफ द सर्वाइकल स्पाइन एंड बायोमैकेनिक्स ऑफ द लंबर स्पाइन ये हम डिटेल से डिस्कस करेंगे। एंड थोरेसिक स्पाइन एंड सैक्रल के हम सिर्फ एक इंट्रोडक्टरी लेक्चर्स लेंगे आप लोगों के साथ। सो यहाँ पे हम शॉर्ट बात करेंगे briefly about the ligaments, about the joints, about the structure of the thoracic spine. So let's go discuss the biomechanics of the thoracic spine. So the components of the thoracic vertebra, they are made of 12 vertebra and they have joint posteriorly the 12 ribs. They make joint with these vertebra. These 12 vertebra, thoracic vertebra, they are also known as the dorsal vertebra, and 12 vertebra that thoracic vertebra are named as from T1 to T12, and as they are called as the dorsal vertebra, so they can also be termed as the D1, D2 up to the D12. There is costovertebral joints, the joints between the vertebra and the rib, the costotransverse joints, the joints between the ribs and the transverse process of the thoracic vertebra, the costosternal joints, the joints between the sternum and the ribs, the interior joints, the interchondral or the intercostal joints, the ZP joints, and the intervertebral disc, which are present between the two vertebral bodies. The thoracic vertebra that is similar in basic makeup to the lower cervical and the upper lumbar vertebra. They're possessing the long spinous process and the design of the vertebra that lead to a natural mild kyphosis. Unlike the cervical and the lumbar region, here there is lordosis. As we have discussed in this previously, when we were discussing the introduction to the vertebral column, there are two types of curvatures: the primary spinal curvatures and the secondary spinal curvatures. So the both the kyphotic curvature of the thoracic and the kyphotic curvature of the sacral spine, they both are considered as primary curvature because they both are present before the birth, while the lordosis of the cervical spine and lordosis curvature of the lumbar spine, they both developed after the birth in the initial years during the developmental life. So that's why the cervical lordosis and the lumbar lordosis, they are known as the secondary spinal curvature. So this curvature, this mild kyphosis curvature is an example of the primary curvature. Why this is known as the mild kyphosis? As if there is increase in the kyphosis, there may be an abnormal situation, and this kyphosis is made in the Cobb's angle, and if the Cobb's angle is more than 10 degree, it is considered as the kyphosis, which is actually a pathological kyphosis. The thoracic spine, they contain less motion than either the lumbar or cervical region. The reason behind that is actually lumbar. The thoracic spine is connected posteriorly with the rib cage, and because of the rib cage, there is no such isolated movement as the movements are in the lumbar spine and in the cervical spine. The T1 and the T12, they are called the transitional vertebra, like the fifth lumbar vertebra, the L5, that was called as the transitional vertebra. The T1 and T2 are the transitional vertebra, as the T1 has similar properties to the cervical spine, and the T12 has the similar characteristic of that of the lumbar vertebra, and that's why in the thoracic spine, thoracic vertebra, these two, the T1 and T12, they are known as the transitional vertebra. The T1, the first thoracic, the 11th thoracic, and the 12th thoracic, they had full costal facet um, rather than the demi facet, while the remaining nine, the T2, T3, T4 up to the T10, these all nine have the demi facet for the ribs posteriorly. Ribs 1, 11, and 12 they articulate with corresponding vertebral bodies. Pedicles, the pedicels, they are directed more posteriorly and less laterally. Some people call it pedicle and some is pedicel, but the correct pronunciation is the pedicel. The pedicel are directed more posteriorly and less laterally, creating a smaller vertebral canal um, than any other region. The lamina are short, thick, and broad. The typical thoracic vertebra that's made up just like the typical lumbar vertebra. This thoracic typical vertebra is made of two parts, the body and the arch. And the arch is again made of the pedicels, the lamina, the physial articulating articular process, the transverse process, the spinous process, and the vertebral foramen. So this is the body, and if we look at the structure, the unlike the lumbar vertebra where the body was in the oval shape, the interior posterior diameter was less than the right and left diameter. So the transverse diameter was more than the interior posterior diameter. But in this case, we can see here there is no such difference, and if there is difference, the interior posterior diameter that is slightly larger than the side to side diameter of the body. We can see here the transverse process, they are a little bit broader. These are the two superior articular process. This is the articular facet superior. These two are the superior costal facets. This is the lamina. This is the transverse process. And if you look at the transverse process, that is slightly oblique, unlike the lumbar, where the transverse process was exactly in the lateral direction. And this articular surface is for the joint uh, between the transverse process and the cast and the rib. This is the typical vertebra, the lateral view, and this is the superior view. This is the body. This is the pedicle is attached here from the body, and till this the superior articular process is short area is known as the pedicel. Pedicel is that part of the arch which is attached to the body. Then this is known as the lamina. This is the costal facet of the transverse process is a point where with articulation with the ribs. This is the superior articular facet which overlap the vertebrae above. This small facet is actually the attachment for that rib. Superior costal facet of each vertebra articulated with the rib, demi facet. This is the inferior costal facet of the one vertebra and the superior costal facet of the vertebra beneath together articulate with each true rib. So this is actually known as the demi facet. This is the spinous process. This is the lamina, the transverse process, the body. This is the vertebral foramina where the spinal cord is present. These two are the articular process, superior articular process and the right and left side. This is the inferior costal facet, deviate facet. This is the superior costal facet, the body. This is the pedicel. This is the lamina. This is the transverse process, and this is the costal facet of the transverse process, the spinous process. The same process. It's having the facets here. The facet they are very clear here. Both the superior costal facet and in the lateral view we have both then inferior and the superior costal facet. Spinous process is a little bit longer, and the transverse process they are in slightly oblique more posteriorly as compared to the lumbar spine. The facet joint of the thoracic spine, the resting position is the midway between the flexion and extension. The closed back position is the extension, and the capture pattern is the side flexion and rotation equally limited than extension. The intervertebral disc, they are thin as compared to the size of the vertebra. That's why having more stability than the mobility. Their ridge shape, posterior height is greater than interior, so contribute to the thoracic kyphosis. Primary constraint to movement considers primary stabilizer. They are usually very few disc problem in thoracic spine, and as compared to the lumbar and cervical spine, where there are too much disc herniation, there is no such cases, no such common cases of the disc herniation in the thoracic region. The joints of the thoracic spine, the interbody joint, that is a flat articular surface which allows movement in all directions. Small size of the disc limit the movement of the interbody joint. The facet joint, also known as the ZP joint, that is the plane synovial joint and the only synovial joint of the spine. Greater range of motion in the lateral flexion and rotation than range of motion at flexion and extension. Capsule is more taut than those of the cervical and lumbar spine, further restrict movement, and that is the reason why the range of motion here is less than the cervical and lumbar. These are the structure of the rib, the angle of the rib, the body of the rib. This is the interior end. This is the head of the rib, the neck, and this is the uh, facet articular surface, articular tubercle for the attachment to the transverse process. And this is attachment. This head is surface is attachment for the vertebral body. So this is the inferior view. This is the posterior view, and we have discussed this earlier. This is the connection between. You can see here. This is the sixth rib. So it means the sixth rib is attached to the transverse process of the sixth thoracic vertebra. You can see here. This is that actually that articular tubercle for the transverse process here attached with the transverse process. This is the head of the that rib attached with the body. Yes, vertebral canal, sinus process. And why the transverse process they are more posterior as compared to the lumbar region, just to make a space, just to enhance this rib which comes from the interior to the posterior. So in case if these transverse process they were 90 degree to the T6, then there would be no such place and there will be difficulty in the enhancing these ribs and attachment to the transverse process and attachment to the body. So remember this point that the rib attached to the corresponding transverse process of the corresponding would mean the four rib will be attached to the transverse process of the T4 vertebra. So the fourth rib, sorry, the fourth rib will be attached to the transverse process of the fourth thoracic vertebra. The ligaments of the thoracic spine they are same as the other ear except some anterior longitudinal ligament and ligamentum flexion are more thicker in thoracic spine than in the cervical spine. These are the superior costotransverse ligament and the lateral costotransverse ligament. These are specific to the thoracic spine because there is no such ribs attachment in the lumbar region and in the cervical region. That's why these specific ligament, the superior costotransverse ligament, which helps stabilize the costovertebral joint, and the another ligament, the costotransverse ligament, that helps stabilize the costotransverse and the costovertebral joints. So they are specific to the thoracic spine. These are the muscles which we have already discussed in the lumbar region, the rotator brevis and longus. and these are the levator casti longus. Specific muscles are located at the thoracic region only. These muscles are very specific to this area because they are attached to the transverse process and the ribs. And as ribs are not present in the cervical and lumbar, so these are the muscles which are specific to the thoracic region. This is the posterior longitudinal ligament, which is present in not only in the thoracic spine but also present in the lumbar region as well as in the cervical region. These are some other ligaments which are specific to the thoracic spine. Exactly the that is the ligament of the costal tubercle that helps stabilize the costal transverse joint. This is the superficial radiate costal ligament. They help stabilize the costovertebral joint. These are the radiate ligament, which is deeper to these ligament. This small ligament, this is superficial, and the radiate ligament, they are deep to the superficial radiate costal ligament. The radiate ligament, they work with the costotransverse ligament to stabilize the costovertebral joint and maintain the position of the rib within the rib cage. This ligament is present between the transverse process and the rib, and that's why known as the costotransverse ligament. That ligament also present between the tip of the transverse process and the tubercle, the transverse tubercle of the rib, and that helps to stabilize the costotransverse ligament. That is known as the lateral costotransverse ligament. So, what are the function of the thoracic vertebra? Stability is more than mobility, so less movement are available. Movement are restricted by structural elements such as the rib cage, the spinous process length, the tart facet joint capsule, thinner disc, thick ligamentum flavum, also known as the yellow ligament, and the anterior longitudinal ligament. Each thoracic vertebra is articulating with a pair of rib by two joints, the superior demifacet and the inferior demifacet. Costovertebral joints and costotransverse joint, the two joints which the rib make with the transverse process and the body of the thoracic vertebra. Costovertebral joints articulate with the ribs through the DV facets located on the bodies, while the costotransverse joint through dual facet on the transverse process. If we talk about the movement, the kinematics of the thoracic spine, so there is flexion and extension, side flexion and rotation, but these movements they are less than the cervical and the lumbar region. Flexion and extension is extremely limited in the upper thoracic spine from the T1 to T6 because of the rib cage and ZP joint orientation in the frontal plane. The thoracic spine can be classified in two ways. It can be divided into two types, in two groups. The upper thoracic vertebra from T1 to T6 and the lower thoracic vertebra from the T7 to the T12. They can be divided into three groups: the upper thoracic vertebra, the middle thoracic vertebra, and the lower thoracic vertebra. Each group that's made of four vertebra: T1 to T4, the upper thoracic; T5 to T8, that is the middle thoracic; and T9 to T12, they are the lower thoracic. But the upper and lower is too common. The kinetics of the thoracic spine, there is compressive forces, and these forces they are increased due to the kyphotic nature of the thoracic spine. The line of gravity that lies interior to the thoracic spine because that is posteriorly convex, so tend to flex the spine. This opposed by the posterior longitudinal ligament and the extensors. So if there is increase in the kyphosis of the thoracic spine, so kyphotic nature of the thoracic is normal, but if there is increase in this angulation, this is known as the uh, thoracic kyphosis. Here is a condition which sometimes may be congenital, known as the congenital kyphosis, mean the person have some incomplete vertebra, and that incomplete vertebra may lead to the increased in kyphosis, and that is present uh, by birth. So that's why that is known as the congenital kyphosis. So that the reason may be two. It may be due to the incomplete vertebra, or it may be due to the uh, fused vertebra. In both cases, they will be called as the congenital kyphosis due to the fused vertebra or the incomplete vertebra. That was all about the thoracic spine, a short introduction and brief explanation to the kinetics and kinematics, the muscles, the ligaments, the joints, the parts, the component of the thoracic spine. Thank you so much to all of you.